Hello, my name is Allison McGrath. The date is 7/2/21, and today I'm going to be talking all about the skeletal system. So to start off, I'll just give you an overview of the main components of the skeletal system, and this includes the bones, the ligaments, the tendons, and the joints. Now, a lot of today's discussion is going to be focused on the bones of the skeletal system, so I think it's important to do an overview of the development of bones and how they come to look like this skeleton model that we see. So at fertilization, the embryo it doesn't have bones yet. Instead, it has cartilage, which can be classified as mesenchyme cartilage or hyaline cartilage. And then around 8 weeks of gestation, the cartilage becomes ossified, and there are two different routes of ossification. The intramembranous ossification is the ossification of the mesenchyme cartilage, and then there's endochondral ossification, which is the ossification of the hyaline cartilage. Now, followed by ossification is usually calcification. It is important to note that there can be calcification of tissues or cartilage, but without the ossification, they're not going to become bones. It is really pertinent that ossification occurs in order for the cartilage or the tissue to become a bone. So now that I have gone through that, I'm going to be talking about the different components of the appendicular skeleton as well as the axial skeleton. And briefly, there are different shapes of bones, specifically 5, that many bones can be categorized as. So as I go through and name the different bones, sorry about that. As I go through and name the different bones, I will also mention what shape category it is involved in. The different categories include flat bones, long bones, short bones, irregular bones, and sesamoid bones. All right. So I will start off with the axial skeleton. Starting at the top of the skeleton, we have the skull, which can be broken down into the cranium, which can be further broken down into the parietal bones, the temporal bones, the occipital bones, and the frontal bones. So the cranial bones are all considered flat bones, and flat bones are mainly used to protect organs. So obviously we have the brain inside of this skull, this cranium, and that's extremely vital to protect. So that's what these flat bones are doing. Moving a little bit south, we can look at the facial bones, which are a part of the axial skeleton. And we have the nasal bone, we have the occipital lobes, we have the auditory ossicles, the mandible, the maxilla, and the mandible. And then we also have the hyoid bone. Then we can move down a little bit further and we can take a look at the thoracic cavity, which is a part of the axial skeleton again. And this is broken down into the sternum and the ribs. As mentioned just before with the bones of the cranium, these are also flat bones. They protect vital organs such as the heart, they protect the lungs, so they're nice and flat so that they don't really puncture any of these vital regions. And then we can move a little bit further down to the vertebral region, which includes the vertebrae, the sacrum, and the coccyx. Now, the vertebrae and the sacrum are classified as irregular shaped bones, and these bones, they don't really follow a clear identifiable shape where they can be put into a category, one of the other 4 categories. So they're put into their own category as irregular shaped bones. Nonetheless, they both serve very important services to the skeleton, but they're just put into their own category. So that pretty much covers the axial skeleton. So now I'm going to move over to the appendicular skeleton. We can start with the pectoral girdle, which is broken down into the clavicle and the scapula. Then we can move to the upper limb regions. So here we have the humerus, we have the ulna, which is in line with the pinky, and then we have the radius. So these three bones are classified as long bones, and long bones are used for movement and weight bearing. Moving down to the hand, we can take a look at the carpals, the metacarpals, and then the phalanges. Now the metacarpals and the phalanges are also considered long bones. They have a role in weight bearing. The carpals are classified in a different group. The carpals are considered short bones. They are more cubic in shape, and they are used in movement and for structural reasons. So then we can move down to the pelvic girdle, and this is kind of like the hip region, which can be further broken down into the ilium, the ischium, and then the pubis. Now, these three bones, this entire region really is also considered to be flat bones. They protect organs such as the bladder, the uterus in women. So it's very important for the protection of those, vital organs. Then we can move a bit further down, and we can talk about the femur, the fibula, and the tibia. Now the femur, the fibula, and the tibia, they're all considered long bones, pretty analogous to the arm. And then also we can take a look at the tarsals, the metatarsals, and the phalanges. These are also with slightly different names, but analogous to the hand, where the tarsals are a part of the short bones. The metatarsals and the phalanges are a part of the long bones for weight bearing. Now I skipped over this little bone, which is known as the patella, and the patella is known as a sesamoid bone, and these are bones that are kind of embedded in tendons, and they are used to reinforce the structure of those tendons. So, that is, obviously there are more intricate bones in the skeletal system, like in the fingers and the toes. There's more bones that I didn't discuss in the cranium and the face, but that's just a general overview of the main important bones. Just lastly, before I finish up, I'm going to be talking about clinical applications, why it would be important to know about the skeletal system. So as I mentioned previously, I want to become a physician assistant in the future, and it would be extremely important for me to know all about the skeleton. I see this every day. I work at an urgent care with physician assistants and doctors, and many times we have people coming in with injuries, to their legs, to their arms, and we send them out for x-rays, we send them out for MRIs, and we write scripts for them. Now, if somebody came in and they said they had an injury to their femur region, and the practicing physician or the physician assistant didn't have great knowledge of the skeleton, they might make a mistake and write out a script for an MRI or an X-ray of the fibula, instead of the femur, and that wouldn't be very helpful to the patient. So obviously there are much more important reasons why it, as a physician, you should know the different components of the skeleton, but that's just a very easy, straightforward reason. It's important to know so that you can diagnose your patients correctly. And that is it. Thank you.